Hi everyone, this is Charlotte at the Laser Image Company. Welcome to our live RHA filler event tonight with Nurse Vinny and Nurse Carolina. You're gonna see some live injections, and we're also gonna have a raffle during the night, and also some specials in the end where you have your Q&As. We also have specials on Morpheus tonight, so stay tuned.
Welcome to our RHA virtual event. I'm Nurse Carolina here at the Laser Image Company, and I'm very excited today to be introducing you to our new line of RHA fillers. I'm going to be talking about the benefits of each of the fillers, and later on we're going to be having a live demonstration so you can see how each of the products work. And lastly, we're going to be doing a Q&A session. For those of you that stick around till the very end, we're going to be having a special offer introduced so you can take advantage of. And here's my colleague at the Laser Image Company, the lovely Nurse Winnie. Welcome, Winnie.
Hi, thank you so much. Hi everyone, my name is Nurse Winnie. I work at Laser Image Company, and I love doing injectables and fillers and our amazing lasers. We have a new great product called RHA. It's very great. It's versatile, flexible, and very moldable, and it's very expressive.
Nurse Winnie, can you tell us about the special offer that we're going to be having for our attendees tonight?
So for RHA, we're having an amazing special where you can purchase from June 7th to the 15th. If you purchase 2 syringes, you get the 3rd one free. Or if you're ever interested in building some beautiful lips, we can also do $100 off per syringe. And if you stay till the end, to the end of the Q&A, we can also get raffling off for 1 syringe for our attendees.
So RHA stands for Resilient Hyaluronic Acid. This product was designed to move with the face. So one of the many benefits is that it's a very natural looking product. We have different products in the line. The first one being RHA 2. This product is the softest of all 3 fillers. It's a very natural looking product used for fine lines and also for a very soft, natural looking lip. Then we have our RHA 3, a product that's really great for moderate folds such as the nasolabial folds and the marionette lines. Lastly, we have our RHA 4. This is our firmest filler. This is great in the cheek area and also for those very deep lines and folds.
So as you all know, there's a lot of fillers on the market, and it makes it a little confusing both for us as practitioners and also for you as a patient. I can only imagine, you know, when you come in and you see maybe 10 or 15 different fillers, like which one is the best for you. So that's why we brought in RHA, only the best for the best, right? So RHA fillers, they have 3 different fillers, and they all have they all fit in different places in the face, because some is a little thicker and some are a little thinner. So it's RHA 4, 3, and 2. So what is different then from the, I would say, traditional fillers and RHA? So RHA stands for Resilient Hyaluronic Acid, which is pretty awesome because you want something resilient in your face, but also something that is very like your own hyaluronic acid that you have in your skin as well. And that's exactly what the RHA are. Their DNA is kind of clever actually. Their DNA is that the filler is dynamic and it's adaptable and it's natural. And of course we want the most natural in our faces, and we want to look the most natural too. We just want to look like we have slept an extra hour during the night. We don't want to have people see that you actually have fillers. That's how RHA work. You can put it very superficial and also deep. So it goes actually everywhere in the face. You can use it on your cheeks, nasolabial folds, mid-face, lips, of course, chin. This is a little bit off label, but chin, you can do jawlines, you can do temples, you can do under eyes. So we can do a little bit of everything, and of course hands too. And the good candidate is actually anyone, just because these fillers can be used very superficial. So if you have very superficial lines, like the crease lines here, or the smoker lines, or the kiss lines, like we call them as well, you can go very superficial with a very, very natural result. But you can also go deeper if you want to build more structure in your mid-face or your jawline or your chin. So this filler, or these fillers I should say, 2, 3, and 4, suits almost everyone, but I always recommend to come into us and have a consultation with one of our fabulous nurses so we can explain exactly what you need, because sometimes patients like you think maybe you need something in a specific area, but we actually have to start somewhere else. And the results can last actually up to 15 months, but that is with full correction. And of course, everyone is so different because we have different metabolism. We maybe work out a lot, maybe we're stressed, and maybe we haven't had the best lifestyle lately. So all of those things differs in both when it comes to fillers, any filler actually on the market, and also when it comes to wrinkle relaxers. So that's always something to think about, that maybe when your friend or your colleague or your mom or your daughter getting something and it lasts a certain amount of time, that doesn't mean that it lasts exactly the same time with you, because of course we're all unique in ourselves. I hope that you will enjoy this evening and the live demonstrations, and we will also have a live frequently asked questions with both Nurse Carolina and Nurse Winnie after the live demonstration. So please stay tuned all the way to when that is happening, because we also have a few specials that will be from today, from tonight, all the way to the 15th, I think it is. And you will get a text in the end of this evening and this live event. Enjoy.
We have our beautiful patient here today, Alyssa. Welcome, Alyssa.
Thank you.
So Alyssa, tell me, what brings you into the office today?
I'd really like more volume in my lips. I've always had kind of a small upper lip, and that's my main concern that I'm here for today.
Okay.
Yeah.
Let me take a look at you, my dear. So when we're evaluating our patients, we usually take a pan-facial approach and look at the patient's face in thirds. But Alyssa here is one of our younger patients, so she's looking for a targeted treatment in the lips, but I still evaluate what else that I might be able to help her with. So Alyssa, taking a look, have you noticed a little bit of volume loss here?
I have, yes.
Okay. And then taking a look too, I also noticed that Alyssa, she's got beautifully shaped lips, but she is getting a little bit of the downturned corners in the mouth, which is very normal. A little filler right there is going to really enhance her lips overall, not just adding volume, it'll make her appear in a happier expression. So lips are a sensitive area, so we always make sure to numb our patients prior to treatment to make sure they're in as little discomfort as possible. All right, my dear, we're all done. Here's a mirror for you to take a peek.
Oh my god, I'm so excited. I love it. The result's amazing. It looks so good.
Glad you like it.
Thank you so much.
You're welcome.
everyone, I have my lovely patient, Suzanne, here with us. So she's in here for a consultation for some fillers. What brought you in today, or what areas did you want to
well, under eyes, I feel like I've gotten like, you know, older. I've lost, you know, elasticity under my eyes, and then in this area here, and then lips. My lips have gotten thin, you know, with age. But yeah.
So every time we do a consultation, we'll do a full face pan assessment. I'll be looking at our patients, taking before and after photos. So when we look, just going to take a look. We're going to look in visual thirds. And over time, as we age, our skeleton and fat pads can kind of recede a little bit. So we start getting some hollowness. RHA is a great product. It's very versatile, dynamic, especially when we're expressing, moving around our fine line areas. So Suzanne, when I'm taking a look during our assessment, as we spoke before, where your concern is kind of like that mid-face area, I would suggest using a product called RHA 4. It's going to give you a nice plump volume, very natural, and it'll blend in beautifully. We'll build a little bit on the little corners here, giving you that beautiful little cheek lift and arch. And sometimes that even helps with this nasal area, lifting a little bit, giving less shadowing. And if we need to build a little more, we can use our product RHA 3, and that will fill in nice, and it'll be very expressive and movement there. And I also noticed down here, you have beautiful lips. Over time though, it can be a little turn around down around the lip side. We can use the RHA 3 there as well. We can fill in a little bit, kind of giving us that beautiful, nice lifted smile.
And then some lip fillers too?
And we can also do lip fillers. We can use either, depending on what your preference is. If you want more of a light hydration look, we can use RHA 2. Or if you would like a little more volume, a little more plump, we can use RHA 3.
Yeah, sounds good.
Perfect. So we're going to be first starting out with building this, the little mid face right here. There's a little bit of loss of volume on this side. So I'm going to be using RHA 4. We're just going to be blending this in beautifully right there, and then building up the little corner, giving that nice little arch. Alright, so we just finished off on the right side of the face. We haven't finished the lips yet, but you can definitely tell there's a beautiful, nice blend rounded out. And here you go, take a little peek.
Oh wow, I can definitely see the mouth going up, not drooping as much. Oh, that's awesome.
Beautiful, natural.
Very natural.
And when you smile, you can see it beautifully blends.
Yeah.
And, yeah. All right, Suzanne, so we did a mid-face and upper cheek rejuvenation, and then we also did a little bit in the lower chin area on the crease, as well a little bit of RHA 2 in those lips to give it a little nice plump and hydration, and a little bit of RHA 3 and 4 right into the nasolabial fold. So here's your first peek.
Oh wow, that looks amazing. It's so natural. I love my lips.
Oh, I'm so happy. It's beautiful, yeah.
That's great.
Gives you a nice little volumization. Yeah. Very, RHA is great for dynamic. If you smile for me, it moves beautifully in, especially after 2-3 weeks, it'll settle in and it'll be perfect.
Oh, I love it. Awesome, thank you.
Of course. Yay, I'm so happy.
I love lips.
Nice, little turned out, nothing too much.
No.
And the corners are beautifully lifted.
It's very natural looking.
So after all the injections, we have our Q&A session right after. Just make sure you kind of tap below and enter in any questions you may have for us, and we'll answer them. And don't forget, for June 7th through the 15th, if you buy 2 syringes of RHA, you'll get the 3rd one free. And if you want any beautiful lips, you'll get $100 off as well. And then we also, if you stay till the end, we'll be raffling off 1 syringe to a lucky winner. See you then.
Hello, everyone. Happy
Hi.
Tuesday. Welcome to our live Q&A session. Hi, Nurse Winnie.
Hi, Nurse Carolina. How is everyone tonight?
We are definitely getting some amazing questions in the chat box. So we're going to read them off and we're going to be answering them. Nurse Winnie, do you want to take the first one?
It looks like our first question, it says, do you treat and consult the same day?
So we can. So when you book your consultation appointment, as long as there's time to do both, or you make the request when you call, and the receptionist can go ahead and make sure that she books you for a consultation and the treatment the same day. So second question, if I have a special event, how far in advance should I make my appointment?
I would recommend at least 2 weeks out, just because we are using certain needles, and depending on which areas, there's more chance of bruising and some swelling and some inflammation that can possibly happen with every injection. So just being on the safe side, 2 weeks out.
Absolutely. At minimum 2 weeks, just in case you do have bruising, it will have time to resolve. If you have the time, it's recommended up to 4 weeks out, just because that's the full time needed so that the filler integrates with the tissue and everything settles nicely. So we recommend at minimum 2 weeks, preferably 4.
So the next question we have, is there anything I should do prior to my appointment to help out with bruising and swelling, and how about after?
Yes, so this is an excellent question. So we want to avoid blood thinning products because, again, the risk of bruising. So basically 1 week prior to your appointment, you want to avoid any non-steroidal inflammatory medications, such as ibuprofen, right? So Motrin, Advil, aspirin also, and then any supplements if you're taking fish oil, garlic supplements, vitamin E, all those thin the blood. However, if you are on prescribed blood thinning medications, you want to consult with your primary care physician prior to discontinuing anything such as your Plavix or your warfarin or your daily aspirin. Very important.
And then things that can help prevent bruising would be some arnica, some pineapple juice. Some people say too, just helps with inflammation.
Right. And we have the arnica gel here in office. We always use ice pre and post treatment because that constricts the blood vessel, so that decreases the risk. Also, we recommend that you do not exercise the same day as your treatment because you're going to increase blood flow to the entire body, including your face.
So the next question was, how many syringes did you use in the second model? So for my model with Suzanne, thank you again, Suzanne, if you're here watching, we use a total of 4 syringes. I use different products between RHA 2, 3, and 4. Like we said, they're all very dynamic, different, and versatile. So it just really depends on the patient's thickness, skin, and everything. But for hers, we definitely use 4 syringes.
Okay, next question. Is this a good filler for those with thinner skin? Absolutely. So as you saw in our introduction, we have the RHA 2, the RHA 3, and the RHA 4. RHA 2 is an excellent filler for those with thin skin. Next question, are the different RHA's different prices? Yes, that is correct.
Yeah, so the RHAs, depending on the different ones and where we're using them, they will be priced differently. We definitely want to see our patients in front of us because everyone's very different, and we do have other products too. We just want to make sure it's the best product for you, and we want to do a full consult. So we'll definitely go over everything, and our consults are free. So at the end, definitely just kind of click that button, and we can do a consult with you and kind of let you know the pricing and everything as well. And I think we missed the other question was, are the for thinner skin?
Oh, no, I answered that
you did?
one.
Oh,
Yeah,
perfect.
yeah, yeah.
Okay, great.
So next question. So I'm in a similar vein. It says, what does a syringe cost for each type? So we're not going to quote exact prices tonight, and I'll tell you why. So every patient is different. Every patient is going to need a different number of syringes. Also, it's going to, before we see you, we don't know if you're going to need RHA 2, RHA 3, or RHA 4. So also there is a volume discount. So the more syringes you purchase, there is an increasing amount of discount. So that's exactly why we're not going to talk about it tonight, but please come in for a consult. It's free. And then you would definitely or call in for a consult, and it'll be, again, absolutely free. And then you can get your custom pricing.
And there was a question that said, can you do neurotoxins and fillers on the same day? You definitely can. Definitely with the assessment on every patient, depending what we're building, like the turn down mouth.
Downturn mouth.
Downturn mouth. So
yeah.
we can definitely do some fillers and do a little bit of neurotoxins to help relax certain muscles and make a beautiful, full assessment.
Oh, how many syringes did you use in the last patient? Which Nurse Winnie answered. It was a total of 4. And yes, let's see. Next question. Do you need to abstain from exercise prior to your treatment? Yes, we recommend you abstain from exercise because exercising increases cardiac output. So it's going to increase blood flow to your entire body, which is going to increase the risk of bruising. Now, after the treatment, first 24 hours, I would recommend take it easy. You're probably not going to feel like working out. So, but then after that, you should be fine. Let's see. Could you please let me know why you can't use Botox around the mouth?
You definitely can use Botox for around the mouth.
You can.
Just depending on what you're trying to treat, though. Like for sometimes fillers are needed for filling in lines, especially I know a lot of my patients do neurotoxins like Botox around the lip areas, but we'll definitely need to use RHA 2, my favorite, which is why I love the RHA so much because it's very versatile, no nodules or anything. And a lot of overtimes it's not even from smoking, it's just from our dynamic movements. We're so expressive and we can definitely fill in those lines and it looks so beautiful.
Let's see. Did we answer the neurotoxin and filler on the same day question?
Yeah.
Okay. Yes,
definitely.
Yes. Depends on, as long as they're in different areas, you can. Will it be affected by IPL? So IPL is intense pulse light. It's not a laser, so it will not be affected. We just recommend just to wait 2 weeks between treatments.
So yeah, with our IPL or any other treatments with radio frequency, heat, or anything, just wait 4 weeks because we want to make sure that filler settles in just in case if anything happens. Mm-hmm.
Let's see. Do you ever use filler in the necklace lines
off-label?
Neck? Absolutely. Yes. This is one of my favorite treatments. Is the lower face. You can definitely use it here in the necklace lines. The RHA 2 product is a really good product for that because it's thin and soft. Again, Technic being the same thing with the lines, and then but if you have banding, which is something that I have, that's a good treatment for neuromodulators such as Botox.
I love this next question. If you have any current filler and need more, can they mix? So definitely, you can use any different products in different areas as well. There is no contraindications between the two.
Is this a good filler to define the jawline and for the chin? Absolutely. RHA 4 would be indicated in this case. It's a strong, firm product, a good structure, so we can use it to definitely build up the chin, enhance that projection, and then also for the jawline, which is awesome.
Next question, does Botox last longer than fillers? So Botox is a neurotoxin. Fillers are different. I would put them in totally different categories.
Absolutely.
Botox or neurotoxins in general, like our other products, Jeuveau and Dysport, they all are usually last 3 to 4 months. But again, like fillers, like RHAs last 15 months. But it depends again on your exercising stress level, as Charlotta has said in the beginning of the video.
You can be a hypermetabolizer or a hypometabolizer.
That's
Hopefully
me.
the latter.
That's definitely me.
Mine seems to last longer than usual.
Let's see.
Oh, okay. Let's see. Well, while we wait for some more questions to come in, Nurse Winnie and I can discuss some common questions that we, oh, there's another one. Okay.
Have you seen this last 15 months in the lips?
So 15 months is the FDA approval. I've personally noticed that it can potentially last even a little longer, but we have to quote what the FDA says, and that's the 15 months. Again, depending on if you're a metabolizer, you can could last a little bit less or a little bit longer. So let me see. So some questions here. So some of the questions that Nurse Winnie and I get here in the office is, am I going to look weird or unnatural? Very important question. So here at the Laser Image Company, we highly value the natural look. That is my personal aesthetic. That is Nurse Winnie's personal aesthetics. So we've had some new patients come in before trying to get more filler on top of old filler. And we've recommended them to dissolve the filler. So instead of coming in for filler, they get dissolver. The consultation is very important. Also, Nurse Winnie and I, we because our aesthetic is a natural aesthetic, we will tell you when we believe that you have had enough filler. Also, an assessment of facial harmony is necessary. So I'll give you an example. So once you get past your 40s, your temples tend to hollow out. So people want cheek filler because they want to lift this, whole area, but it looks unharmonious if you do not also fill in the temple. You get something that you call the flying saucer cheeks, which is, not a good look. So you want to start with some temple filler, build up the cheeks, and then it looks much more natural and it does not look weird. That's also because the RHA collection is, they are dynamic fillers. They do have a more natural and softer appearance.
Any areas that you kind of love injecting or you want to kind of talk about with the RHAs?
Ooh, my fun area is the lips. I mean, it's just, that's just so much fun, but I mean, there's definitely, I think my personal favorite, because I was somebody that was, I'm a sinker. So I had very hollow temples and, the temples take a lot of product, but the results are definitely worth it. I used to have what I called the crypt keeper face, but now you can see I have nice.
You're gorgeous.
All
of our faces are gorgeous.
So that's definitely one of my favorite areas to treat, along with the lips. What about you, Nurse Winnie?
I really love doing a lot of mature and younger, but for my mature patients, I love really building that like hollowness in our mid face that we get, and kind of like that little heaviness in the nasal fold, and kind of especially those, I notice lip lines, smoker lines, as you all call it. That's why RHA I love, I know. And it's so superficial, like you can't feel the lumps and bumps, very natural.
Okay, so somebody is asking, what are flying saucer cheeks? So flying saucer cheeks is when you basically have too much filler in the cheek, or at least it's disproportionate with your upper face. And it does have this appearance of like, a flying
more
saucer.
Like alienated. Some people I feel like freak out because back then the older products of fillers are very more like bulky, but now like RHA, it's very aggressive and dynamic.
Yes. So let me see some more questions. Let's see. Oh, another common question that we get.
What is the volume of one syringe? I want to see if everyone can hear us.
Can somebody type in if you can hear us okay? Looks like we might be having a little bit of connection issues. Somebody just confirm that you can still hear us okay.
Yes, we can
Oh,
hear you.
perfect. Okay.
So one of the question is, what is the volume of one syringe?
It is only 1/5 of a teaspoon.
Like
so
this small? Like anything?
yeah, it's very small.
Yeah.
So it would take 5 syringes to be the equivalent of a full teaspoon, which is, if you look at a teaspoon, I mean, that's not a
Yeah.
lot. So by the time we hit our 40s and 50s, we've probably lost up to 20 teaspoons of volume in the face. Now, we don't have to go 20 syringes because you can do a lot with a little RHA. So, but just, if you're like, again, 40s and 50s and you've never had filler done and you come in and you say, I want one syringe, you're asking for a lot.
So we have another question here from one of our patients. What filler typically used to treat on the face? Deep lines. Would you recommend RHA over a lip flip? I know the lip flip wouldn't last nearly as long, but does the RHA achieve the same look but last longer?
Okay, so there's a few questions in there, so we can break this down. So, so what is filler typically used to treat on the face? So filler is used to treat volume loss, which is that's what makes it different from neuromodulators such as Botox and Jeuveau, is that
Muscle
actually stops
relaxants,
muscle movement. So that's what filler does. So yes, deep lines, because deep lines are caused by volume loss. Would you recommend RHA over the lip flip? I know the lip flip wouldn't last nearly as long, but does RHA achieve the same look but last longer? Definitely. So the lip flip, that's one of my personal faves. This is filler and lip flip. So I recommend the combination. So I had filler in my lips just to restore the volume that I had lost over the years. And then I maintain it with the lip flip. So the lip flip is very subtle. It doesn't last very long. So it lasts anywhere from 4 to 6 weeks. And again, it's very subtle. So it's great, but I think most people would want to start out and try to see what they would look like with filler, with doing a little lip flip. But then most people decide, okay, I like this lip flip, but I want it to last longer. I want some more volume.
And sometimes, like, if we even use one syringe, we don't have to use a whole syringe staying in the lips. What I like to do is just do like a partial, we'll do like a little lip flip with some neurotoxins, like maybe 50-60% of the syringe in the lips, just to give you a hydrated plump, nothing dramatic, just giving that little volume again, kind of decreasing those lines on the lips. And we can just go into the shadows or any other areas you're concerned of, the smoker lines, lipstick lines, or around the creasing too.
For smokers lines, even if I don't smoke,
lines.
will that take one syringe? Well, it's going to be patient dependent, but typically one syringe is usually sufficient for the smokers lines. And usually it's actually, you still have a little left over. So we usually kind of treat those little downturned corners that we keep talking about. So if, say, your target problem, one syringe is more than enough, then we can use the rest of the syringe somewhere else on the face. Let's see, some other questions that Nurse Winnie and I get. Nurse Winnie, will filler hurt?
Not the filler by itself, but we are definitely using, of course, a needle or a cannula going in. We definitely numb our patients prior. We use like other techniques like vibration tools, ice, and everything. It's very tolerable. And we also can do like dental blocks with some lidocaine for the lips, especially that area is just a little more sensitive. So we definitely have, depending on our patients and how you feel, we'll definitely try to make you comfortable as possible for the treatment.
Right. And the RHA product has lidocaine in. So as soon as we start injecting, that lidocaine starts kicking in. And then some areas are just more sensitive than others. Lips have a lot of nerve endings. That's definitely a sensitive area. And but things like areas such as the under eye would not be as sensitive, surprisingly, because most people fear the under eye, but it's not much discomfort there.
One question here, what is cannula and why is it used?
So cannula is different from a needle. It looks like a needle when you take a look at it for the first time, but it actually has a blunt end instead of a sharp tip. It's good to reach certain areas because they're typically a lot longer. So you'll see a needle will be maybe like 1/2 inch, but a cannula is like 1.5 inches. So if you need to
and
reach
it's just
like all the
one
way,
entry point where we're coming in. It just really depends on which area we're treated. Just a different instrument that me and Nurse Carolina can use.
Absolutely, and it does because it is a blunt tip. It tends to have a decreased risk of bruising. It's not foolproof, but it does, again, because it doesn't have a sharp tip, less chance to bruise. Perfect. These are really great questions.
I know.
So that one?
Yeah, I just did that one. Yes. Perfect.
So we talked about the downtime. And then we talked about the how much filler. See any more questions?
Let me see. No, I think this kind of is wrapping it up with the questions. Yeah. So once again, at the end of the video, you're going to receive a text for a consult. If you just click the link, it'll kind of redirect you to the office number. And then we're still having our specials again for the RHA fillers from the 7th, which is today, to next week, the 15th, for our specials, which is the buy 2 syringe, get the 3rd free, or lip special, $100 off. And then if you stay till the end, very end, we're going to receive a list, and we will be raffling off 1 syringe as well. And when you get the text, just make sure you answer yes. And when you do the consults with us, we're also really offering the little free gift bags as well. Oh, there's another question. Wait, never mind. I think it's up there. Yeah, perfect.
There. Okay.
Okay. I think that is it.
So don't forget, when you receive your text, make sure to reply yes. And we thank you so much for joining us tonight and taking the time. Thank you, Nurse Winnie.
Yes, thank you everyone for joining us tonight.
Good night.
Good night.
We hope to see you soon. Bye.